Welcome to Innovating Clinical Trials, the podcast designed for clinical research professionals eager to deepen their understanding of clinical trials through concise, insightful segments. Join your hosts, Liam Eves and Ted Traffer, as they uncover the core issues in clinical research, reflect on the industry, and challenge conventional wisdom.
Ted, how are you, sir?
Liam, I'm doing great. How are you?
I am good. I'm really good, actually. It's been a busy period, which I can never complain about. Well, I can, but I won't.
Yeah, you can try.
I can try. You can see it on my face.
Yeah. Oh, amazing.
The wrinkles are coming, and they're great.
They're deepening. Yeah.
yeah. Thanks for that clarification. The deepening. I've had some really interesting conversations recently with a few people, and it actually came up in a conversation yesterday that I want to touch upon and perhaps have a little conversation around, which is actually trust in clinical research. And I've been thinking about this and trying to understand it a little bit deeper, in a sense that there's a few directions of trust, right? So you have your classic for the CROs to the sites. I love giving this example. It's how many patients have you got? Oh, we've got 20. CRO, 20. Oh, okay, right. Just put them down for 10.
Yeah, exactly.
And it's like everyone's playing this game, right? And
That's right.
To win the work. And there's like this disconnect to say actually what is real and what's not. Then so there's that aspect. Then you've got the trust around the patients and the industry as a whole. And I think that as we see more and more with this polarization of social media and what have you, I suspect we'll see probably more extreme versions of what has always been the case, right? There's some distrust. So there's this this sort of like zeitgeist of distrust amongst not everyone, of course, but like groups of people. And then there's the trust that needs to exist between a patient and the researcher or the healthcare provider come researcher, which is really critical. And then there's this trust that falls out around the referral process, where I see an advertisement on Facebook or whatever, and therefore do I go for that particular clinical trial, right? And there's elements of but they're like the four categories that I've been thinking about, and I'm sure that there is a lot more. So, like, for instance, what's really interesting is that when organizations start looking at, okay, what's my funnel going to be? We always categorize like a funnel, don't we? And say, oh, well, we need, 10 patients at the top to get one. And it's like, well, actually, like, trust is like has a massive impact on where that funnel, the performance of that funnel. Like, we know that the conversion rates are much higher in organizations where patients have a relationship with a researcher or a healthcare provider. Yet, so that funnel may look like let's say a 5-to-1 ratio, whereas like the digital channels are significantly higher, right? It may be 50-to-1, and I think that a lot of that is down to trust. It is like that, and that trust it takes so long, particularly from a clinician to a patient, to build. But once it's there, it's like it's really there. And the thing that blows my mind is that when we're looking at budgets for sites, we never really factor in the time that it has taken to build that trust and that relationship. And I give you a good story with that. Is so I remember when I was working directly with patients, and we were running an Alzheimer's trial, and it's 2:00 in the afternoon, and waiting for this patient and a caregiver to come through the door. And about 15 minutes late, they come through the door, look completely wiped. So I took them into the consent room for this particular study and started having a bit of a conversation. And I just paused for a second, and I did something that probably felt a bit wrong at the time, which is I just closed the consent, and I just was like, can I make you a cup of coffee or a cup of tea? You guys look frazzled. And I sat with them, and I spent, I want to say, at least 45 minutes with them, just finding out about like what had happened during their day, and like, was there anything that we could do to help them. It was nothing about the study.
Right.
I would have been seen to be wasting time, when in actual fact, what I did was something much greater, I think, which was that I built a relationship. And those Karen, the lady's daughter, still contacts me today. And that lady took part in 3 or 4 clinical trials over the space of her disease. And I think that we don't spend enough time thinking about those things and actually employing the trust factor into research. And maybe it's not trust, it's relationship probably with the patient, and that actually we care. And I think that takes so much time, but sites are never really paid for it. So anyway, I've waffled for far too long.
That's all right. As soon as you mentioned the funnel, it struck me as a little bit humorous, because I've actually been writing about the holes in the funnel in the recruitment process. And that's kind of how I view the funnel. And we used to get feasibility questionnaires. There was a period of time where all of a sudden sponsors had this brilliant idea that we're going to improve recruitment if we make sites in the feasibility process document the entire funnel. So what's the top number, total number of candidates, patients in the database, whatever. And then if they drilled down clearly enough in that funnel, it was going to increase recruitment. And what they failed to recognize are all the holes in the funnel. And some of those holes are created or happen because of lack of trust. I think that's really interesting. There are situations, for example, in advertising. How do you build relationship? How do you build trust when you have maybe less than a minute when you're engaging someone who responds to an ad?
Absolutely.
And if we just dive into the pre-screening questionnaire and go through the, do you have this? Do you have this? What medications are you on? Is that really helping to build that relationship and the best path forward when you're talking to somebody who is potentially interested in this study?
Absolutely. I think that where it all boils down to, it's really seeing the human. We apply such a scientific rigor to, like you say, the pre-screening questionnaire is a great example, because like, oh, do you have this? Do you have, and a relationship is more about the individual. It's more about being the human and actually, and there's obviously a massive delicate, like, people have to be wanting to take part of research based upon their own accord, of course, and all those things. But I think that it's where we lose a lot of, I don't want to say credibility, but I think it's where we lose something in that not really engaging with that person as a person. I mean, I always look at it and say, well, these individuals who are responding, whether it's to an ad that on Facebook or through an email blast from a site's database, it's really trying to, like, it's a scary thing going into research, right? And it's I think a lot of time people are looking for, not that we can give them any assurances, but I think that it's just that someone is there with their best interests at heart, and that they're at any point and any time that they need to have a conversation. And I think that it's those soft skills that are critical for the conversion, because I was talking to someone yesterday and I said that for me, the protocol is the protocol determines the width of the funnel, but it's the human and the logistics that convert those and those conversions at each stage, because the reality is that you can only allow those patients to match the criteria, right? And that has a particular width on it. And our objective is to give people the best experience we possibly can, given what we can do within the confinements of the regulations and all the rest of it. But it's to really, I think, see the person.
And I want to draw you back to the conversation that we had with Frank Watanabe from Arcutis, where their first operating principle is the patient is paramount.
Absolutely.
And are we truly approaching recruitment with that
in mind,
top of mind?
And I think that when you speak to people, a lot of groups will say, "Oh yeah, we do that," and it's like, well, how are we doing that? Like, I spoke with 3 people last week, and they're saying, "Yeah, we want to do those things, but no one's willing to invest the money into it." And I think that investment piece is a really critical part of it, which is helping unlock what is important to those patient. And I think that anyone who's not investing in that area is as you've pointed out there with Frank's thing, is you don't have the patient really in the top of mind. If we're not asking their opinions, we're not getting their thoughts, because ultimately it is about their experience through the process.
Well, and not respecting their time.
Yeah.
So if someone responds to an ad and says, "Yeah, I'm interested, tell me more," and we don't get back to them as soon as humanly possible, that's not showing them respect. No. And then their perspective is that, well, if they don't respect my time, if they're not truly interested in getting back to me, why would I talk to them about this? So we've got a lot of work to do.
Absolutely. And it's I think it's ridiculously hard as well, because like the site staff are like so busy, right? And it's like, okay, well, I'm fitting this research around my other stuff, or I've only got a couple of hours to do this, and I've got patients coming in and so on. It's 9 to 5, blah, 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 blah. So I think it is a really hard problem to solve. And actually, I think that the only way that we can truly solve it is not just paying it lip service, is actually investing in it.
It needs the resources to do it well.
Yeah. Because that's
absolutely
that's the part of the biggest challenge. But yeah, I'm needing to think about this quite a bit deeper. But it's I think it's a really interesting space that certainly brought to my attention.
Amazing. Well, thanks for bringing this up for discussion today. I think we've only barely scratched the surface of trust in clinical trials.
I think it'd be interesting to get some people on that specialize in this area, because I think that there's a profound psychological value to it. So
absolutely,
I'll have a little look, so people don't just have to listen to me waffle. They can listen to an expert.
We can get some experts on to dig into it.
Yeah,
amazing.
Sounds good. Thanks, Ted.
Thanks, Liam.
Take care.